Hi, I'm Dan Gardner, and I talk about traumatic brain injury recovery. And today I'm pleased to be talking to speech and language pathologist Herb Hein.
Traumatic brain injury recovery.
Welcome, Herb.
Thank you.
Let's start by your telling me about your background. How did you get into this arena?
A speech language pathologist not only works with speech, but works with language. And when I was first having my clinical fellowship year, I worked with a young man who had had a brain injury. I then moved to Children's Hospital in San Diego. I worked with Chris Hagan, who had helped to establish the levels of cognitive functioning. And I worked there at Children's Hospital several years, and I started working at pediatric brain injury unit. At that time, my wife was working at Sharp rehab next door, working with adults. And then both of us started working for the San Diego Brain Injury Foundation at its infancy.
I see. So Herb, can you tell me exactly what does a speech and language pathologist do?
A speech language pathologist assesses speech and also assesses language and assesses cognitive function. That's the most relevant for what we're talking about here. And so we're looking at someone's memory, looking at their ability to pay attention, looking at their ability to focus on information, being able to analyze information, organize information, and that's in terms of what they're saying, in terms of what they're hearing, and in terms of how they're acting. The other thing that's very important is monitoring their ability to monitor themselves. So that is also another challenging, it's a challenge, and then we assist people who have had brain injuries or anyone else with that. So focusing on the brain injury aspect of my background, the other thing that I do now, because I've been doing this for 41 years, is I'm also helping people with their emotional regulation too. I work with people who have emotional regulation challenges. So I've used some of my background and some of my experiences working with people with their thinking skills to help people to work on how can they use their thoughts to control themselves and interact with people in their world in a better manner, in the most appropriate manner.
I see. So in addition to the assessment, you do the speech and language pathology treatment. And can you give me some examples of how you treat brain injury patients?
Well, when I was working at a house for people who had brain injuries, that was originally called the NeuroCare and then became a Sharp Rehab community reentry program. When I was working there, I trained myself to be very functional so that speech language pathologists will often work on some paper and pencil kinds of tasks, helping people with their ability to read and write, being able to answer questions, and being able to answer some personal biographical information, that kind of thing. But what I found when I was working at this house with people who had to get back to their lives was that I had to think about what was happening with their physical therapy treatment, with their ability to move, what was happening with their occupational therapy treatment, with their ability to cook or to shop, to get around, and then also with their vocational treatment, with what is it that they're doing with their lives, and how can I help them to become as productive as they can be right now.
Right. So Herb, I want to just underscore the importance of that. You're saying that you're not just treating symptoms like improving the memory on a pencil and paper test or a computer test. You're saying, okay, I want to help this patient improve his or her function in the real world, in their daily functioning, like shopping and cooking and cleaning and organizing and taking transportation, all the important things that everybody has to do.
Correct. Yeah, so one of the strategies then is actually a paper and pencil strategy, and that is to use a daily planner. So people who have, well, if you don't have a brain injury, it's useful to have a plan for your day, right? So
sure helps me.
So if you don't have a plan for your day, you say, well, I don't know what I'm doing, and maybe I'll do this, maybe do that, maybe I forgot something, right? So if you're an organized person before you have a brain injury, you have a lot going for you, right? So the thing is that if you, I will help someone to keep track of what they just did, what they're doing now, and what they're needing to do next. So it is remember where's your paper brain? What's next? Can you take notes? Can someone help you take notes on what is it that you're doing now and what you're doing next? And can you be oriented to what's next? Mm-hmm. So not only is what am I doing for my day, but also it might be what am I doing right now in my task. So it could be that we're setting people up to use checklists. What am I doing in order to cook this thing? What am I doing in order to fill out this form? What am I doing in order to do any kind of task? Okay, so I've worked with a variety of people on almost any task that people do in their lives to be able to set that up, whether it's their activities of daily living in the bathroom. How do I get ready in the morning? How do I make breakfast? How do I get to the bus? How do I remember what I was reading this morning or yesterday? How do I do my job?
You help people get organized, you make lists and so on. Now, nowadays, there's so much technology. There's the iPad and the iPhone and Amazon Echo and so forth. And then, of course, paper and pencil. How do you know which of those to use? How do you know when it's helpful and when it just causes more confusion and frustration?
Well, it's really up to what the person was used to doing before. So we're going to go back to their automatic behavior. So I'm not going to get someone who has been using their Google Calendar to become someone who's a paper pencil person, because they don't even know what that is anymore. So it's really what were you using before to organize yourself, and use something as similar to that, because that's going to be their go-to. I'm going to remember what I most like, how I did this before, right? So that is the key, to be able to remember that right there, as it's more complex, as you know, to be able to do that.
So you figure out what they did to stay organized and remember things prior to the injury, and you use a system that's as close as possible to that. So the implication is there's no one-size-fits-all. You don't say, okay, here's a great iPad app or an iPhone app, and you start using this if you've never used technology.
No, right, because going back to the assessment part, as you know, and as some of your viewers may know too, every brain injury, every injury is different. And that really is also what intrigues me about this, helping people in this area. It's figuring out the puzzle. It's like Humpty Dumpty fell, and then we're putting back the pieces. So it could be that a person has lost some visual skills, right? So reading and writing tasks aren't going to be very helpful, right? So there may need to be some adaptive equipment for that, or something else that needs to be done there. I've worked with people who have lost their ability to read, just because the part of the brain that focuses on recognizing letters and reading has been damaged. So I've helped people to read. And thus, this one particular person learned how to read and then could use that schedule. But the first step was to be able to do the reading. So in terms of what areas we're looking at someone's ability to understand information, what you're hearing, what you're reading, and being able to, how well you're able to express yourself by speaking or by writing. And then some of the other areas we're talking about, how well they're able to problem solve, how well are they able to have appropriate judgment, those kinds of things, which is a lot trickier. And what I would want to mention in terms of a challenge is that sometimes people say there's no problem with me. I have no problem.
Right.
To other people, it's quite apparent that there is a problem. So in terms of when it becomes most difficult, that is when it's most difficult, when you're trying to say, but do you see this is difficult? No, I'm fine. I don't need to do anything different.
That is a big challenge when there's this unawareness of deficits.
Correct. That is difficult. So sometimes we're able to get someone to be more aware of that, and sometimes not. The other thing that's very important, as you know and your viewers may know too, is providing the information to whoever is this person's support system. What is the best way to communicate with this person? What is the best way to cue this person so that they're able to function the best?
So a big part of your job is training the support person.
Right. I find that the more we're able to provide the right level of information, expect the right level of behavior, so that there's less frustration. Because if we're not presenting at the right level, if we're expecting too much and we don't know what that right level is, the person's going to be frustrated and not be able to perform and cooperate at their highest level.
Right. So that's a very important point you made, Herb, that you want to train the spouse or the caregiver to not only implement but reinforce these strategies.
Correct.
You've given me a few examples. Are there other examples that come to mind?
Well, many years ago, I worked with a young man who had a motorcycle accident. And he was very famous. He would just bolt out of places. He would display a lot of anger. So this was very, very frustrating for his parents, very frustrating for whoever was trying to have him be wherever he needed to be in a program. And then also this was that the person who was no longer able to read. So in working with him one-on-one, I actually did teach him to read. He was able to relearn how to read because we're able to teach aspects of that as well. I would present some guiding sentences to him and that his parents would use as well, some orientation. This is where you are. This is what we're doing next. This is where you are. This is what we're doing next. This is what I can do to calm myself. I can breathe. Some of those kinds of things. So that ultimately he was able to manage himself. He was able to remember by having the guiding thoughts presented over and over again that finally got him to be able to be oriented. So the caretaker, his parents and other people needed to know how to manage that in case he started to escalate, started to get out of control. That young man was able to ultimately use a basic schedule and work at a nursery. To have that kind of control so that he could work for several hours, follow a schedule. That was an amazing progression from out of control, can't read, to can read with checklists and go to work and be successful. There's someone else who fell off a scaffolding and had a brain injury from that. This was someone who loved to read, but because of his injury, he would forget what he was reading. So what are you reading? I don't know, and I don't care. So, well, maybe it might be nice to keep track. So we'd add a little log of what you read. Let's see if you remember what that was, so that you can then tell me, and you can tell yourself what you read. Ultimately, after months and even a few years, this man was able to really keep track of what he read, and became important for him to know what he read. That kind of thing. This was also a man who was a writer. His writing was a little jumbly because he couldn't remember what he had just written. There was no monitoring for, does this make sense? So I was able to be that guide. It was really a guide of what he would be himself. Let's read this over. Let's see, where do we start? Where are we now? What are we leaving out? Where do we need to go next? Those kinds of questions that we ask ourselves I just was asking those questions of him. So ultimately, he then was able to independently write in a more coherent manner. So those are a couple. In 41 years, I could really go on and on.
I see. Well, thanks. Those are great clinical examples, and especially impressive when you're training someone how to reestablish their self-regulation. Very impressive.
Yes. Yes.
So, Herb, tell me, what in your work over these many years, what have been the biggest challenges and the biggest satisfactions?
Well, I'd say the biggest satisfaction is being able to have someone like that young man who was so out of control to be able to for me to assist him to be able to have that kind of self-control and be able to have a productive life again and be able to have harmony in his family in that manner. Someone else, I worked with another man who I'd worked with years ago, and he came back to me and said, I'm someone who had a brain injury, and I'm really wanting to get this certain kind of job. Can you assist me? So I was able to have him get involved in the solar industry. Mm-hmm. He needed to use a lot of checklists to be able to go through his job. So there's reading involved, there's memory involved, there's organization involved in that, all those kinds of things. And then the big thing is that self-monitoring. Am I able to self-monitor? Mm-hmm. So
I see.
One of the things that I felt was successful in my life was, I don't know if you can see this here.
I can. Yes, I can.
This is a book I wrote because I was working with about 40 people in one program to help them to be assertive listeners. And so I wrote this book, Strategy Power, which still exists. And if your viewers want it, that they can have it, that it's available to them. It helps to teach that I need to be assertive. I need to be in charge of my listening skills. And if you're talking to me too fast, I need to have you slow down. I need to ask you to repeat. I need to ask so that I get that information. And I'm not just sitting here being passive. And I've helped a lot of people so that they can become assertive listeners, which is really
Herb,
good.
that's impressive, because in the line of work I do, I'm aware all the time about the need for people to enhance their active and assertive listening skills.
It certainly helps me, and I still use that in all of my assessments when I'm working, even with people in elementary school or high school. I also, in my practice, I work with people of all ages, people in schools, helping them to be assertive in their classrooms. Mm-hmm. What I wanted to mention was I did work in classrooms, in schools, and then I worked in hospitals, and I was involved with the traumatic brain injury and thinking about a cognitive approach. Then I went back to work in schools, but I was thinking in terms of the same kind of approach. We're always thinking about the brain, always how the brain is functioning. And sometimes in schools, it's compartmentalized. We're not really thinking about how is this brain functioning in terms of attention to and sequencing and that kind of thing. So, and then I went back to work with adults. So I've been able to use all my experiences, my earlier experiences, as I progressed and worked in different areas, different kinds.
So you've had a wide range of experiences and work with both children and adults. And you still work with children and adults?
I still do. In my practice, Hein Speech Language Pathology, my wife and I work with little guys, 2-year-olds, 3-year-olds, 4-year-olds, preschoolers, and also school-age kids, and then also people who stutter, people who have had brain injuries or strokes. So we'll see people in the office or see people out in their homes or wherever they're working. I also see some people in some high school programs. I work with people who have high-level autism, and I just developed a program for them and also for people with emotional challenges and just people in general to be able to, similar to my brain injury treatment, to think about what's the thought that will help me so that I can make my best choice in my interactions with people.
What's the name of that program and where can people find it?
Well, the name of that program is, let's see, can you see this here?
Yes, I can.
Growing Green Interactions. That is the name of my program, and I just we just put out some flyers here too. Can you see that?
Yes, I can.
Hein, slpinc.com.
All right. So that's where people can buy that?
There's my little visual cue. So that's another thing, we always want to, as much as possible, provide some visual cues to help us remember. It gets in the brain a little bit more, gets in there deeper. I'm sorry, what did you ask?
So people can buy this program at that website.
People can buy the program at the website. The other thing that I do in my life, and you may know it, is that I'm also a singer-songwriter. So I do have songs that go with that program, songs for guiding green thoughts. This is on iTunes, it's on Spotify, and also it can be through CD Baby or our website, and you can hear the music on our website. And here's another album that I wrote called Optimism Returns. So it's a very useful thought to have.
Herb, you're a multi-talented guy.
In our modern day, yes, and occasionally I sleep. so yes, I'm actually very, very excited about this program being used in schools with third graders and up. So that children today, whether they are third graders or seventh graders, or else people who have never learned how to interact with other people as if they're on a team, learn to do that. So
wonderful. It sounds like a wonderful contribution, Herb. So let me ask you, what advice do you have for TBI survivors, their family members, and what advice do you have for healthcare providers who work with brain injury patients? Well,
you have to have a lot of patience, and you have to understand. I don't know if you could see this as well. Can you read this?
Yes.
Okay. So this is something that Joanne and I like to present to people with brain injuries or who have any kind of a difference, whether you've had a stroke, any challenge to your brain, right? So what's the old me versus the new me? So if you are still functioning as if you are, if you want to function, you might want to function like you were before your injury. You desperately want to do that, and you can't. It's just going to be a frustrating experience. So the client and the or the survivor and the people who are helping the support system, it's really important to try and get to understand the new me. What is your new functioning? So
to understand and accept.
Understand and accept the new me, because you might need to have that information repeated again. You might need to be more careful. You might need to do this or do that. Use some strategies in order to be successful, to reduce some of your frustration and to increase your level of functioning. So the sooner, whenever it's possible, for a person to be able to know their new me, and that's something that I might do in terms of providing, well, these are your levels of functioning in all these different areas. Physical therapists would do the same, occupational therapists, any mental health workers as well. This is where you're at right now, okay? Mm-hmm. From my point of view, do you see that as well? Okay, so what are some things to do? And the most important thing is for that client, that person, to be involved in the process. You'd be like, oh, this person does this person does that. What does that person do for them to be their own assertive person, to them to be aware, for them to know what to do. And then you have the most important person on the team, the person who knows what he or she needs to do. I'm a advocate of that for whether it's a person with a brain injury, an adult, or whether it's a student in a school, right? The student needs to know, what am I working on? What is my main goal so that I can improve myself? That's why I can advocate for that, all those kinds of things. If we leave the student or leave the client out of the picture, we're just going to be having to work a lot harder.
It occurs to me as part of the coming to terms with the new me is to grieving some losses. Well, I'm not the way I used to be in a number of areas, and some important ones, and accepting the new me, and then finding meaning and purpose in life with the new me. Yes. And I know that you've been very creative in helping some of my patients find outlets to feel meaningful and to make a contribution. I'm thinking about someone who you encouraged to write a blog, someone who you played guitar with. What about that?
Well, what I will say to people, and I said it to that man who ended up being in the solar industry, who wanted to be in work for the police force, and had some experience doing security, or something that was a little bit more complex, that involved more daily judgment and problem solving, which he was not going to be good at. This is not your strength area. So don't have a job where that's your it's no longer your strength. So, but it was a strength. It was a hat that you wore. You wear it proudly. Put it on your shelf. Say, I was that in my life. I did that in my life. So it's not that I have to mourn that it's gone. I can celebrate that I did do that. You know, life can be long. Life can be varied with all kinds of things that we do and we achieve, but things don't last forever. That one didn't last forever. Let's try something new. So that kind of approach lets the person move from mourning to, I can still be happy about that and proud of it, but now I'm going to have my energies focused on whatever is new.
So there's a new way. There's a new way to make a contribution. Herb, what other things would you like to add about working with traumatic brain injury patients and their families?
That there is the San Diego Brain Injury Foundation available for resources, many resources and support, so that there are meetings for the caregivers who can support each other, that the person needs to take a break, both the survivor, you know, you can't like keep working. You need to have a break so that we can rest our brain. And the same thing with the caregiver. The caregiver also needs to like go out and think of no problems for a few minutes or an hour or as long as possible. Get someone to come in and take over for a little bit so that they can re-energize, get refocused. So I think that is an important part, because otherwise the survivor, the caretaker, they can just spin and just burn out and can't move forward on anything. You take a break.
Amen. So we all need to recharge our batteries.
That is true.
Herb, anything else you want to add?
There is one other thing, and that is something else that I've actually, my wife and I presented on in some brain injury meetings, is this, sometimes it's useful to, can you see this?
Yes, I can.
Okay,
yes.
So it's a binder, categories of my life. So this is what I like to have a lot of clients use so that they don't feel like they have to remember everything. There's no way. So if they can remember that inside here is the information they need. So there's lots of ways to keep track of where I am and whatever I'm doing, okay? We don't want to get overwhelmed with that. It needs to be, it can't be more complicated than a person can handle, but if a person is able to read, as a person is able to remember, and a person can find things, then they can find the most important things that they need to remember in their life, and it's like having a paper brain. For people who are in the modern day and are using technology, they then would have to know where they're finding all their stuff and how to access it. But that's another approach to take for people who are not using paper. But I like to be able to know it's right there in front of me, because even on a cell phone, it's gone if the screen's not open. Out of sight, out of mind. I believe in insight, in mind. One more point, I guess, is that we're not done making ourselves better, right? We're not done making ourselves better. So sometimes we think that we are complete, but there's nothing else to learn. But we always can learn something new. And if we're open to that, whether we have a brain injury or not, our lives will be richer.
Herb, I want to thank you for spending the time and effort to talk to me today. Explain how nobody's perfect, we're all works in progress, and we'll do the best we can to optimize our potential. So thanks very much, Herb.
Please like, subscribe, and comment on this video.